they panic when they're on call. They're too afraid because they don't want to miss the patient call, so they don't sleep. How many times can you go taking call and not sleeping throughout the night and then expect to go to work the next day? It's a lot to mentally prepare for, and that's where for mental health, sleep is a very important factor to all this.
Okay, so Michael.
Hello, Gil. How are you?
Good, man. I'm super excited to sit down and talk with you today.
I'm excited too. This is a topic that's somewhat passionate to me, and I feel that's very important to at least bring awareness to everyone.
Yeah, absolutely. Well, we've been talking, before this started, for those, well, I guess as a spoiler alert, we are going to be talking about mental health and stresses of the job as an EEG tech, but not only just an EEG tech, but a healthcare provider in general, right?
Yes.
Because I think what we can do, whether you're a nurse, whether you're a doctor, whether you're a pharmacy technician, a neurotechnologist, these are all things that we share together as healthcare providers are these stresses. You see it all the time. Hospitals are looking for healthcare providers in all fields. So, there's a lot of burnout happening. You saw that in COVID.
Yep.
Yeah. And you've seen that in forums and mental health forums and things like Reddit and stuff like that is, hey, we're in need of nurses.
Yeah, and I think that's the biggest, probably one of the biggest concerns about mental health, mental awareness, burnout, and everything. When we go to school, we learn a lot about what we're going to perform, these skills to care for people, how to care for them, learn to put an IV in, learn to what the x-ray looks like, or in our field, we learn 10-20, how to push the machine, how to do a calibration, check impedances, the meaning of that. Yeah. But then when you really start going into these really things that you will be doing on the job that you might have heard of, but then you weren't really prepared to do, like what's it like to take call? What's it like to take call for 24 hours and then realize you have to be back at work at 7 a.m.
Yeah.
Going into these very sensitive areas, the ICUs, trauma centers, learning to sometimes mind your P's and Q's, but then also trying to make conversations with individuals. These are a lot of these tasks we learn when we are doing it in comparison to probably maybe we should bring this up so that way individuals will have recall to remember hearing about that or knowing about, I remember talking about that. So this is the situation they were talking about.
Yeah. Yeah. And I think, we're so focused on the technical part of our jobs or the providing part of our jobs as healthcare providers that we, and maybe things have changed, but 20 years ago when I first started, mental health and burnout and compassion fatigue, those were words I had never really even heard of. And just now we're actually starting to, and I think COVID brought a lot of this on, is hey, healthcare providers, take care of yourself mentally and stuff like that. And before we get started, let me introduce you, Mike.
Oh, yes. So, we could probably talk too much before.
Yeah, we can go
on and on.
And we are going to go on and on. So that's why I'm super excited to sit down and talk with you. So, Mike, tell us a little bit about yourself.
So my name is Michael Bustos. I have been probably in the field about the same length of time as Gil, 20 years. Some days I feel like I've been even longer and even shorter.
Yeah.
I'm kind of probably one of the more traditional individuals that get in the field of neurodiagnostics. Went to an associate's program, did that, I hold EEG, EP, CLTM, NA-CLTM registries, and then never thought I would be in neurodiagnostics for this long. I always thought it was going to be a bridge to something else, and that's where neurodiagnostics has offered me a lot, and I've been able to accomplish a lot. I was able to, while working at the hospital full-time, having the hospital pay back some of my tuition, go back for my bachelor's, master's, and then ultimately, I think that's where a lot of people get to a point in this career. What's next?
Yeah.
And I imagine this might be a topic for us to talk again.
Yeah.
in the future about like when you move on from putting electrodes on people's heads, when you move on getting those basic real good EEG skill, can I push an EEG machine for the next 30 years?
Yeah.
Am I okay with being woken up at 2 a.m. For 30 years? So that's kind of where I kind of branched out in admin, all that, and more so just like going through all that. I have gone through a lot, either personally, emotionally, mentally, and that's kind of where now I'm at a point in my career that I've been able to get to. Won't Can't say like I'm hoping everyone, if they're not able to, I'm hoping they're able to get to the point where I got quicker, maybe with a little less learning experience, negative, all that, but then also like being able to bring back the joy of like what this profession has, and that's where mental health is a big factor. Two things.
And even though, this could touch on everyone, like I said, every healthcare provider, every specialty, we are neurodiagnostic technologists. And so we're going to have a heavy focus on that. And, for the techs that are actually listening, or for the people who are wondering or thinking about getting into neurodiagnostics, what I love about this industry is there are, just like you said, entry level where you are putting electrodes on the head, maybe in the outpatient setting to begin with, and you move into the ICU, all the way up to you are notifying the neurologist what abnormalities are happening on the EEG. There's such a wide range, and Mike is actually, like he said, he's an NA-CLTM, which is a neuroanalyst, certified long-term monitoring specialist, and that's the very top, right? So
the very top of EEG, and that's kind of where like it was one of the reasons why I got into this profession. It allowed me to work with other things. So if most people don't know, neuroscience, neurodiagnostic, it kind of deals with basically testing of anything neurologically. A lot of it does deal with the brain, but there are aspects of the profession that branches out in other parts, muscles, nerves, and so on. And that's where like I did IOM or neuro monitoring for decades. And
that's monitoring surgery.
Yes, that's monitoring surgery. I can use the sentence like I'm not doing brain surgery, but it's probably the closest I'll ever need to do brain surgery without having to like go to residency and stuff like that. I've been close enough to a brain where like I could touch it. Neurosurgeons asking me like, do you want to see this? Like, do you want to get closer? And I'm like, no. Yeah. I think I'm close enough. I should be mindful about the brain, but like being able to be caretaken in that, be a part of a team, being part of like caring for patients. And that's kind of where like I reflect back to, this is a lot of reasons why a lot of people get into the healthcare field. They want to work with people. They want to help people. Yep. And so on.
Yeah. And you had mentioned that you didn't know that neurodiagnostics was going to take you this far. And similar to me, I didn't, I was a transporter at the hospital, and then the supervisor for neurodiagnostics asked me if I wanted to get a job doing, putting leads on heads. And then that's what kind of started mine. And then I thought, all right, this is a stepping stone to something else. And it just, it's a new industry. So while I was growing in neurodiagnostics was growing. There was the launching of remote monitoring companies.
Yes.
There's IOM, there's Evoke Potential.
Yeah, and that's where like the healthcare profession's always been one of the more driven trendsetters, adapting to like new technology, trying to implement new things and so on. And being a part of that does provide security, knowing that like this profession or this like industry is trend setting, and you have the security of knowing that you'll be needed in the future for employment.
And you can go like you said, you can go different ways. I went a different path than you did.
Yes.
I've never done IOM, and you have.
Yeah.
Neurodiagnostics is so unique. Like you had said, Evoke Potentials, that it's not just the brain, it's it can go out into your limbs. I tell people all the time, there's neurodiagnostic technologists that take care of numbness in your arms and legs, and people who may not be aware of that, I love to see the surprise on their face when they say, wait a minute, a neurologist takes care of numbness in your arms and hands and feet. And absolutely, because it's your central nervous system, which all stems from your brain.
Yeah, and I think that's where like communicating with individuals about everything, knowing who you're communicating with and the individuals you're communicating with knows what to do with that information on like who would be the best. And that's kind of where for mental health, you as an individual developing your voice.
Yeah.
Sometimes it's difficult for new or old people or senior people who've been in the field for decades to like craft their voice, develop like when they should speak, when they shouldn't. Is this a big concern or issue or not?
Yeah. And, you know, we talk about all these different modalities, all these different paths that we can go in neurodiagnostics that actually falls in line with what we were talking about today, which Mike had said. We are talking about stress in the healthcare field in general, and particularly with our experience in neurodiagnostics. And so with all those modalities, there's so many things that we can do, that we can get our, hands-on experience in, that it could be overwhelming and it could be stressful, especially since there's not very many of us out there. And the need is growing. I talked to Dr. Coles. You saw the podcast with Dr. Coles. He talked about the need for neurodiagnostic technologists has never been higher, right? And so because there's so many things that we can do. Talk to me a little bit about your experience in just kind of being overwhelmed and stressed and kind of what you did in that.
Being overwhelmed and stressed comes in many different ways. Some of it, you believe it's just, that's the nature of the job. I was at a pediatric hospital for decades running, as everyone knows, sometimes the peds population can be difficult due to the cooperation of the patients, the workload, the need of the interactions of both patient and guardians. So you have more factors to deal with. And then ultimately, just sometimes a 2-year-old will just not, even though you tell them it won't hurt, they will not let you do it.
Right.
And things like that. So there's that factor on top of running time management on how many EEGs you need to get done, trying to figure out how much time it takes to perform. And then we haven't even talked about the stressors of performing the test, how hard it can be, whether if you're just working in an outpatient lab or on the hospital side, in the inpatient part, working with difficult patients. Difficulty comes in many different ways. Like in the ICU, since we fall under neuro, we see a lot of traumatic brain injuries, aneurysms. Typically with traumatic brain injuries, that does deal with car accidents, gunshot wounds, non-XLM trauma, and all that. And those are...
And even dementia.
Yeah, dementia. Yeah. And that's where I've dealt with that's funny, for me working with a lot of peds, dementia, schizophrenia, all those neurological things, because there could always be a seizure or neurological component before you want to decide that it's a psychological issue. And that's where we've come to the point on making sure things doesn't get misdiagnosed, making sure that tests are being done on patients to try to give them the most accurate diagnosis.
Yeah.
But with all that being said, it does become very wary, especially, and then on top of that, fragmented sleep, changing of sleep because of call, you're being woken up at certain times, trying to respond back. I remember those times at the hospital. Sometimes I just left the hospital and they paged me 10 minutes later. I'm on the interstate and I'm hey, I'm just going to get off the interstate, U-turn back and head back and then go do an EEG.
Yeah. And that's not safe because like I said before, there's not enough technologists out there. You see that with call. I remember actually being on call one time, exactly like you were saying, 3 a.m. I woke up, I was just completely out of it, and I shouldn't have been driving. I was in the mountains in Denver, Colorado, and there was a deer asleep on the street. And I was like, oh, there's a deer on the street. And it didn't process for me to, put on my brakes until I got really close to it, and it didn't leave. And I slammed on the brakes and I barely missed that deer. But I started thinking to myself, I have got to take a break from call. And these are some of the stressors that people who have never been on call overnight might not really think about, or may take for granted that they don't have to do that. But it's a consideration that you always have to, especially managers out there in neurodiagnostics, is make sure that the person on call is being taken care of. Don't let them, take 18 days in a row of overnight call, because that can be a big stress and not healthy.
Yeah, and that's kind of one of the biggest things. Like, I have a story about a coworker, or no, she reported to me. Yeah, got called in the middle of the night, like 2-3 o'clock, and she got hit by a drunk driver.
Oh my goodness!
Because that's 2-3 o'clock in so that's the kind of time that people are leaving bars.
Was she okay?
Oh yeah, she was fine.
Okay.
She was fine, but then like she had to reach me. She's like, I can't make it to the hospital because my car, I got in an accident and I can't. I have to deal with all this. I'm like, okay, thank you. I think I went in and helped her out and figure that stuff, and that's kind of where I'm technically I'm a manager in neurodiagnostics that knows how to perform the study.
Yeah.
But that's where, like, if you don't bring like awareness, like if the call, you have to be very specific when you talk to higher ups, be very specific. Why is the call killing you? Or why are you getting overly called? How much time? How often are you being called in for? Like, what are the reasons these doctors are calling it in? Is there certain spikes in the certain time? And those were conversations like when I was at the hospital as a manager, I had to ultimately discuss constantly with the director, like, why are we doing this? Like, one of the biggest thing is, like, after a certain amount of time, I think we figured out, like, no more stat routine EEGs. We're just calling people in to hook up for continuous, because there was always that dance on, if the EEG was grossly abnormal, they'd need continuous.
Yeah.
If they didn't have the event, they needed to go on continuous. And ultimately, like, percentage wise, like, there was probably a few patients, or that patient like in the morning when I continuous. So I was like, can we skip this middle part? And that's where, for a lot of people, if you don't know, running a routine and flipping it over into continuous isn't as easy as it seems, especially if you're using collodion, what electrodes, if you have the right different machines. Like, it's just another hassle to that whole mix. But that's where call can be very difficult. And the same thing on the individual. Have you, before your neurodiagnostic job, have you ever taken call before? Are you a deep sleeper? Will you listen to the pay? Will you listen? Will you hear the text message go off? Will you hear it? Are you going to oversleep through it? Or those other people that I've started to see a lot, they panic when they're on call. They're too afraid because they don't want to miss the patient call, so they don't sleep.
Yeah.
So, like, how many times can you go taking call and not sleeping throughout the night and then expect to go to work the next day and just, like, run like a normal day, 4-6 EEGs, continuous monitoring, or going to the OR doing intraoperative monitoring? It's a lot to mentally prepare for, and that's where, for mental health, sleep is a very important factor to all this.
Sleep is becoming such a focus in a lot of mental health because of all the studies that are coming out. I mean, there have always been studies of how important sleep is for mental health and just being healthy, but more so recently. Mm-hmm. And I don't know, do you have I don't know if you've seen Andrew Huberman's podcast on the deep rest, non-sleep stuff, but I started doing that and it was absolutely fantastic. And for those who've never heard of it, Andrew Huberman Lab podcast, it's an absolutely amazing podcast. But what he talks about is whenever you're laying in bed, if you're having trouble resting or having trouble going to sleep, and this is actually what I heard people in the military do in order to sleep at the drop of a hat. But what you do is you lay down on your back, hands to your side, eyes closed, and you just do a mental check on every part of your body that you actually can. So you start with one instructor, and there's instructors on YouTube, but one instructor was saying, imagine that your brain, your hemispheres of your brain are two clenched fists, and you're just opening up those fists and de-clenching them, if you will. And that was the visualization that I started with. And then you work your way to your nose, to your mouth, relax your jaw, relax your neck muscles, relax your shoulders. So this is a technique that I would use to help me, or started using to help me get to sleep. Did you have any kind of, what helps you sleep? Like, do you have
I'm
any
sleeping
routines?
better now, but like I'm always an overthinker, and I'll probably take that and start trying to use that to try to sleep better.
Yeah.
And that was always like, you don't really recognize like the poor sleep habits till it becomes too big of a problem on all that. Like I've learned to like try to prevent overthinking.
And how do you do that?
I allow myself 10 minutes to think on a task, and then I completely stop, because I could go on and on about a problem, trying to come up with solutions, alternate solutions, and things like that. So I've only given me 10 minutes. Like I worry less about the what ifs or having a solution to what if that would happen, what if this, because I was a very multitask oriented, or like I felt like I always had to be prepared for everything.
Yeah.
And
so give me an example of your 10 minutes,
example. Like right now, trying to figure out when I was at the hospital, trying to get multiple staffing members like trained into the OR. Like, how am I going to do this and do performing the IOM myself, because it was a service that we offered, but then I didn't have a lot of staff trained, and I was the most senior. So trying to train all that. And then
so you gave yourself 10 minutes to like, hey, I'm going to think about this logistically. How am I going to figure this out? I'm going to give myself 10 minutes to really think about it. And then if I don't come up in 10 minutes, maybe I'll revisit it.
Yeah, I'll revisit. I'll put it away and revisit and start on a different problem and stuff like that. The biggest thing, like in doing that, it's helped me. Like I don't have like a billion things to rotate through on problems like that. So, and that's kind of where experience does help out a lot for individuals being put in those situations, like knowing where your limits are or what are your triggers to figure out what to do from there. And that was where like I had a very tough time just stopping, which ultimately led to me thinking about it in bed. And the bed is a great place to think, but it's a terrible place to think and sleep. Think and sleep, exactly. So that's where like you have problems and that's where like tossing and turning, and that's where ultimately I've learned to sleep aids are beneficial. I don't take them every night, but then I know I can get into a pattern of not sleeping till like it's really, I could probably go a week to 2 weeks like having like fragmented sleep. So ultimately I've made a decision to myself, like after 2 nights, like I'll deal with the fogginess of like a sleep aid that will cause me in the morning. Yeah. But I will try to like just knock myself out, so that way I know I get a good like reset to my body, reset mentally. Like the fogginess I'll figure out, or like right now, like being a manager, I'm salary, so I can kind of start my plan. I can plan out my day a little later and then like work later too, instead of like having those committed hours, like always having to be up at 5. Yeah. And that was kind of one of the things that I worried most at the hospital, or like I had all these worries that either I didn't have control over, or like, is it really a worry that I should worry about this? Yeah. Or am I just causing more undue stress onto things? And that's where a lot of people have that struggle on. It's not making like a small thing a big thing, but then it's probably more so the idea of approval of others. Yeah. We want to make sure that everyone is approved, or we're more concerned about what they're going to think than how it's going to affect yourself.
Well, we're care providers, correct, and the helping other people, quote unquote, the approval of other people when we help them too is something that we look for. Yeah. And I think even if you're not in the healthcare industry, I think that resonates with a lot of people is, hey, the stresses of my job and pleasing my boss or pleasing my customer or, whatever the case may be. I think, everyone really struggles with that.
Yeah, and it's something I've been working on, talking, like, I see a therapist. I've been seeing this. I like therapy so much. I found another person to go see. I found a life coach. I was like, just
on top of your first
on top of my therapist. No, it's a life coach, not another therapist.
Okay,
like more so like getting different perspective of things. The biggest thing like I learned, each one can provide support and help in different ways, but then that's where like probably 10 to 15 years ago, you would have seen me very against like those formal support aids and help. And these are all they're a benefit for a reason.
Yeah.
They're under our insurance. They're one of the reasons why like the hospitals provide so much like EAP and all that, because they've recognized.
And what is EAP? Sorry to interrupt.
EAP is, oh God, what is that acronym? Employee, I think it's like an employee assistance program.
Okay.
Or like different hospitals have different employee assistance programs depending on what they find
that focus on mental health.
This one's like one of the big ones that the hospital I was at was supporting like mental health. It had a 1-800 number. It would help me find a therapist. First 6 meetings with the therapist was all on the hospital. I didn't have to pay for any or pay for anything and stuff like that. And these are benefits that sometimes you don't look into, or like you shouldn't look into something when it's a huge problem. If you're starting to see signs, then you should probably look at it then. And I think that's one with mental health, trying to bring the awareness and trying to see when is the small problem getting worse. And that's kind of where like a lot of people kind of miss out on a lot of the mental signs. And this one of the biggest mental signs that I tell a lot of people is when everyone, especially my parents, would always tell me like, I'm tired. You look tired. And
when people start telling you look tired, you're probably tired.
It's more than that, and that's where like I would give them the answer. Well, I work a lot. I have a busy schedule. I was up early this morning. I would always visit them after that. So I kind of made excuses, or I made like reasons why I look tired. But then when they see me now, that's not the first thing that they bring up.
Yeah.
They see either something in my demeanor, my eyes, that like I don't have that mental fatigue, or like I have that feeling of being worn out. And that's probably one of the biggest signs that I've reflected and seen that it's important.
And so do you attribute, being aware of your mental health, seeing a therapist, do you attribute all that?
It's a lot of things. Like therapy is not a one-stop, like fix everything. I've been going to therapy 5-6 years, and this recent one is my, I've stayed with her the 6 years. I saw a different one before, because I think when I saw her, I was seeing her for different reasons, and I thought like a promotion would have been the instant gratification I needed that would solve all my problems.
But
it didn't. And then like same problems started coming back. So I started seeing this new one. Ultimately, a lot of like, coaching, different mental process thinking. I started an antidepressant that helped a lot. Like medication, it's not always bad. Like I'm on a low dose. Like my biggest problems were like my emotions were a little swingy. And when I swung to down, it was really hard for me to get back up. Yeah, like I was like very depressed, very just like anxious, like, and then you don't realize like all these other factors, like once you get into those lower emotional states, depression, anxiety, stress, you start not sleeping, you start feeling, and then you start going like days, weeks, months, and then ultimately like, and that's where I think I tell a lot of people, like, be flexible.
Yeah.
And stuff like that. Be willing to help support and stuff. But then also, like, you don't know, nothing's flexible to the point it won't break.
Right.
If things doesn't change, like, it will break. And
it'll snowball.
Yeah. And that's where I did break. I had to take a mental leave for a while just to recalibrate, reset, and do everything. And then after that, the funny thing is, I reset it and then COVID hit. Yeah, so like the timing for me was like at least I was at a better mental state when COVID hit.
Yeah.
But then after that, like I really started asking myself like the deep questions. Is this worth it to me? Is this what I want to do? I got this position that I felt like was going to solve everything.
Yeah.
Am I the right person? And then ultimately you start feeling guilty. Like, am I a failure? Am I being less successful? Am I not supportive? And then this is all like these like internal conversations that are never beneficial to individuals and stuff like that. And that's kind of where talking with therapists, like that's where I decided like now's the time. I've been at this facility for 15 years. I got to the highest position.
Why am I not happy?
Yeah, why am I not happy? And that's where that's when I started looking for other new jobs.
Yeah.
And stuff like that. And
trying to fix it. I think it's important for someone with your accomplishments to actually, it's brave to say, hey, I'm at the top, and being at the top, it doesn't provide you happiness like you think it does. And I think it's really important for people like you to say, hey, we need to focus on our mental health. Myself, I've gone to therapy. I've been to a therapist for the last maybe 8-10 years.
Yeah.
And it used to be something that I didn't want anyone to know. That was the stigma around it, and I'm not trying to create victims or self-pity. I'm not into self-pity at all. But therapy and mental health is not self-pity. It's you focus on your body's health, right? Your muscles, cardiovascular health. You have to take care of your mental health, especially healthcare providers. I mean, looking at this list that you and I were talking about beforehand, it's, the things that come along with healthcare, providing healthcare is you get compassion fatigue, which is one that really played with me big time, is because when I first started, I would see these patients and my heart would just open up for them and I wanted to take care of them. And then later on down my 20-year path, I started becoming like, oh, it's just routine. Let me take care of this patient and get out. And I've got to do the other EEG. And that really played with me because I didn't feel as compassionate as I have been in the past. And I felt guilty about that. But the thing about it is we have a job to do, and we are, no matter how we feel while we're taking care of the patient, if we're taking care of that patient, it benefits them. But you just feel guilty, like you said earlier.
And that's where, feeling guilty, a lot of us who get into the healthcare field, we want to work with people. We want to help people. We're thinking of other people. And that's where, compassion fatigue, either a lot of people become compassionate about themselves. They're thinking too much about other individuals in comparison to themselves, not thinking about what's stressing them, or becoming accepting of this is just how things are. And you really don't know if that's how things are, or if it's just how things are poorly organized, planned, or there can be other ways to doing things. But that's where, for a lot of people, some people don't like change. Being able to take the risk of leaving a job that they've been for years to go somewhere else. That's where this whole slogan, is the grass greener on the other side? No, yes, it's still the same grass. So, and that's where making the decision on making that jump, it was a very internal struggle, because I did have all those feelings of self-doubt, concerns about am I giving up? Am I running away? And then also for the staff, I was overseeing the feeling of I'm a failure, I'm leaving them to handle something else. And ultimately thinking about all this, it's not beneficial to anyone.
No.
Than anything else. I think now I tell people think about yourself, about well, sometimes it's okay to make a selfish decision.
Yeah.
And that's where for like, especially us in healthcare,
Yeah.
we don't make selfish decisions kind of thing. So that's where like, if you're making a reasonable decision, you've thought of everything, like, and you feel like it's best for you, like, how can anyone judge you on thinking like you're being selfish? You're doing the best for yourself.
Yeah. Well, let's end this. This has been an awesome discussion,
Yes.
Mike. This is something we have to touch on again for sure. Let's put a little bow on this conversation by really talking about actionable items that people in healthcare can actually do. We talked about taking care of yourself mentally, sleeping. Talk to your physician about medications, possibly.
Yeah, for
therapy.
Individuals, yourself, like therapy, taking vacations, not pulling it up. That's one of the biggest things. Like, actually plan things out so you have things to look forward to.
Yeah,
and things like that. Especially, and then like when you're on the vacation, like this digital age,
disconnect.
Yeah, like you just. Like, there was one vacation, I didn't bring my cell phone with me because I was going to a resort.
Yeah.
And so I didn't have access to anything.
Mm-hmm.
Like, it was nerve-wracking, but, like, you have to learn to disconnect and stuff like that. While you're on vacation, that's the same thing as, like, taking a day when you're just taking a normal, like, 3-day weekend or just a prolonged weekend. Like, learn to disconnect, or this is one of the big ones, like, don't come to work sick if you're sick. Like, you're sick, take care of yourself, take the time off, instead of like knowing like there's gonna be a huge workload. I don't want people to think negative of me and stuff. Like, you're sick, like, and that's where like fostering a good work environment with others, being able to like not feel like your decisions are gonna be criticized, ridiculed, on like they're calling out too many times. Like, sometimes like there are peaks and troughs, and that's where like just voicing your opinion to admin or your manager and letting them know. For like managers, since I've been in admin for a while, like being very close to the staff, recognizing their triggers, trying to at least move the needle. The needle is hard to move in the hospital, but like try to move it a little bit, see what you can do. One of the biggest things I've learned from like hospital administration, future planning is so important. You can't make the request then and there. You have to plan it out, like keeping stuff in reserve just in case. I think one of the things, like, I always had, if I didn't post the FTE, I always had one job position always approved of just in case if I needed it. Thinking about alternatives, creating a network so you can talk to other people about how they solve the problems, because the problems that you're having, most likely other people, these are common problems to everyone. It's just a lot of people play chicken with everyone on who wants to go first, and that's where I'm not. I've learned to like I'm wide open and vocal about everything, but then also like alternatives, especially like in the field of neurodiagnostic, and your last podcast about the CAP, alternative ways to get EEGs done. Not everyone in the nation can have a registered EEG tech or a multi-registered one at every hospital. So those facilities, EEGs need to be done to prevent longer care, prevent transports, and so on. So that's where like thinking about outside of the box, like trying to find how you are going to solve this employment problem. How can you is alternative technology better than good old traditional that you've been doing for 10 years? Like, and
can you utilize it
to help your
work-life balance, your staff's work-life balance?
Yeah, and that's kind of where, like, I think I tell a lot of people, like, it's a tool. Like, how do you use the tool? A knife is a multi-purpose tool. It cuts meat, it cuts things, and sometimes I use it as a screwdriver, but sometimes I shouldn't use it as a screwdriver, and that's what we should think about the techs. Like, they're able to do all this, but sometimes, like, maybe I should get that other person or the other tool to help out, or ultimately help them out to perform their task quicker.
Yeah. I've always thought, pull yourself up by your bootstraps and take care of things. And I still believe that, but as a health provider, pulling up your bootstraps might mean that you take time for yourself. It might mean that you go on a staycation. Let's say you don't have enough days or enough financial reserve to take a vacation somewhere else. Take a staycation, go on a walk, take care of yourself, because us as healthcare professionals, we forget so much about taking care of ourselves, and that directly affects how we take care of other people. So, Mike, thank you so much for sitting and talking with me. Dude, let's do this again real soon.
Yes, I imagine we're going to do this sooner than later.
100%. Well, my friend, good to talk to you.
Thank you.
Thank you for tuning in. Our next week, we're going to have Navita on, and it's going to be absolutely fantastic. So don't forget to tune into that every other Thursday. So stay tuned.